If you look at the history of liver transplantation, many say that it really started here in Pittsburgh with the first real liver transplant program. Fast forward to 30 years and we're still at the forefront of liver transplantation. We're doing more live donor liver transplants than any other program in the country. Because there are not enough deceased donor livers for all the people that need them, there's a priority system. And the way you get to the top of that list is really based on priority, how sick you are. And so the sicker you get, the higher you move up on the list. Our philosophy certainly is anyone that needs a liver transplant can potentially qualify for a live donor transplant. And so a live donor allows us to bypass that and essentially do the transplant when the patient is in a relatively healthier state. It allows us to offer transplants to patients who wouldn't otherwise qualify for a deceased donor. Often we hear from referring physicians that, well, I didn't refer this patient because they told me they didn't have a living donor. We have something that's called the Champions Program, which essentially teaches patients who need a liver transplant how to go about the process of identifying a suitable living donor. We've been fortunate to have a low incidence of COVID infections in the Western Pennsylvania area and the Pittsburgh area. I think the risk of holding on to a patient, especially if they have end-stage liver disease, is actually greater than sending them to a relatively safe place such as this, where we have a significant number of measures in place to ensure patient safety. The mission of the liver transplant program, and in fact the entire transplant program, really is to help individuals with end-stage organ disease recover from it with good quality of life and get back to work and get back to living life on a sooner time scale.